Hello, my name is Dr. Kathryn Martin, and this is IV Family Health Updates. In a separate segment, we talked about postmenopausal hormone therapy. And in this segment, we're going to be discussing alternative treatments for hot flashes, non-estrogen alternatives. Now, this is most relevant for women with breast cancer or women with a history of breast cancer because these women, estrogen is not an option. But it's also relevant for women, postmenopausal women who choose not to take estrogen or women who've already done their course of estrogen and who have now tapered off and stopped. Some of these women, their hot flashes come back. For most of these women, they're relatively mild and they don't need any sort of therapy, but for others, they can be moderate, severe, and persistent. And it's these women that we have to think about alternatives. A small subset end up going back on estrogen, but for the others, we try a number of alternatives. None of these alternatives are as effective as estrogen, but we do our best and try and get them through the next year or two until the hot flashes are entirely gone. Now, the best option, I think, that's available now is a medication called gabapentin. The trade name you may be familiar with, it's called Neurontin. This is actually a seizure medication. It's used for other things in addition to seizures. It's used for neuropathic pain, pain from the nerves, or chronic pain. It's sometimes used for bipolar disorder as a psychiatric illness. But it's now been studied quite a bit for women with hot flashes, mostly breast cancer patients with hot flashes. And of all the alternatives, in my opinion, but I think it's some of the, many other experts would agree, it's probably the most effective alternative. And it's taken as a single dose at bedtime. And the reason for that is hot flashes are actually most common during the night. Other alternatives include some of the antidepressants, for example, paroxetine or Paxil, and some of the other SSRIs, but of those SSRIs, Paxil is probably the most effective, but it doesn't seem to be quite as effective as gabapentin. And then there are some complementary therapies or herbal therapies that have been studied or very popular. For example, black cohosh. It's been reported that about 90% of women with breast cancer take black cohosh, and sort of anecdotally, many women find it to be very helpful, but very recently a very, very large, very well done clinical trial was reported that found it was no better than placebo. So it does not seem to be effective, and there are some concerns about taking black cohosh, but I think that's the trial that proves that black cohosh unfortunately just isn't effective. And then lastly, phytoestrogens or soy. Does dietary soy help? We know that in countries where a high soy diet is ingested, those women, a number of things, it seems to have a very important health benefit. For example, in Japan, those women at the time of menopause have less breast cancer, they have less heart disease, they seem to have fewer hot flashes. Is it related to their diet? We honestly don't know. But there seem to be health benefits, but we don't know if it's a good strategy or a healthy strategy if we hit age 50 at the time of menopause, if we suddenly increase our dietary soy. We now know from a number of clinical trials that loading up on soy or dietary supplements, red clover or soy, probably isn't of great benefit for your hot flashes. So clinical trials comparing these supplements to placebo doesn't seem to be better.
Well, you know, certainly a lot of my patients, they're all afraid of taking estrogens, which, as we've discussed in another segment, they shouldn't be if they're in their 40s and their 50s, but they're all looking for some sort of an herbal remedy. And so now we know that the cohosh doesn't really work, and the other things don't really work. So do we have anything other than a prescription medicine that would help with the hot flashes or the symptoms?
Well, I would say the gabapentin, definitely.
But I mean
non-prescription. Well, in the trial that looked at black cohosh, they also had an herbal mixture that had really just probably 8 to 10 different herbs that they combined. That was also no better than placebo. And virtually every herb that you can think of has been tested against placebo. There are all sorts of clinical trials. So ginseng, dong quai, not better than placebo. Acupuncture has been studied. Vitamin E, primrose oil. Really, there are a lot of things that have been tried that are popular, and so far, it doesn't mean that they're not effective, but in the clinical trials that have been done so far, they haven't been proven to be better than placebo.
Okay, so it may work for some individuals, but you can't say everyone would benefit from it.
But is there any downside to going up out and loading up on these things, taking these herbal products?
That's a great question. For some of them, yes, there's a potential big downside. That's true for the phytoestrogens or soy and the black cohosh. And it's a potential big downside for women with breast cancer. And that's because both black cohosh and soy have properties that are just like estrogen. So that means that these compounds could actually stimulate breast cancer cells to grow and divide. So we really discourage our breast cancer patients from loading up on these supplements. It's never been proven that it's going to increase the risk of recurrence, but we do have some concerns about that.
And how about some of the skincare creams actually talk about having a little bit of estrogen in them? I don't know if that's going to help with their hot flashes. I don't think it's going to help with their wrinkles. I just can't imagine that, you know, the penetration of the estrogen into the skin, which is what they're saying, is going to help directly with the wrinkles. But is there enough estrogen in some of these creams to cause some problems? Or?
Absolutely. This would be probably comparable to delivering vaginal estrogen, which we'll talk about in a separate segment. It's almost certainly not enough to treat their hot flashes, but for a breast cancer patient, it is certainly enough to increase the risk of a recurrence. For women with breast cancer, even a small increase in their blood levels of estrogen can at least theoretically increase the risk of having a recurrence. So I certainly would discourage women with breast cancer from using those kinds of products.